Hello, I am AARP Senior Vice President Jean Setson, and I want to welcome you to this important discussion about the coronavirus. AARP, a nonprofit, nonpartisan membership organization, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of the corona pandemic, AARP is providing information and resources to help older adults and those caring for their loved ones. Today, we'll talk with experts about telehealth options and discuss how Medicare, Medicaid, and the private insurance have adjusted regulations to expand telehealth access during the global pandemic. If you've attended one of our teletown halls, you know that this is very similar to a radio talk show, and you'll have the opportunity to ask questions live. If you'd like to ask a question about the use of telemedicine during this global pandemic, please press *3 on your telephone to be connected with an AARP staff member who will note your name, your question, and place you in queue to ask that question live. So let me go over our expert panel today. Joining us today, we have Andrew Gettinger, MD, Chief Clinical Officer from the Office of the National Coordinator of Health Information Technology from the U.S. Department of Health and Human Services. We're also joined by Tricia Neuman, Doctor of Science, who's the Senior Vice President at the Henry J. Kaiser Family Foundation. Lastly, we're joined by Dr. Joe Kvedar, MD, President-elect of the American Telemedicine Association. AARP is convening this teletown hall to help you access information about the coronavirus. While we see an important role for AARP in providing information and advocacy related to the coronavirus, you should be aware that the best source of information around health and medical information is right now coming from the Centers for Disease Control and Prevention, otherwise known as the CDC. You can access more information at cdc.gov/coronavirus. Just so you know, this event is being recorded, and you can access the recording at aarp.org/coronavirus roughly about 24 hours after our event today. Today, we're talking with experts about how to stay safe, healthy, and connected during the global coronavirus pandemic. These are very trying times these days, and for many of us, we are here to help you. So AARP is advocating tirelessly for our members and all people age 50 and older during the pandemic. Let me just share with you a couple of the things that we're doing on the advocacy front.
First, AARP has fought to ensure that Americans whose primary source of income for Social Security is Social Security is also receiving payments of up to $1,200 in the recent economic stimulus package. We've also pushed for expanding unemployment insurance benefits as well as paid sick leave and family leave for people who are taking time off to care for themselves and for their loved ones. While we've been hard at work in Washington, D.C., AARP representatives across the country are also fighting for you by working with state policymakers on a range of issues, from virtual visitations to nursing homes, telehealth, paid leave, and preventing evictions, foreclosures, and utility disconnects. I just want to share a few of these with you. AARP has successfully advocated to expand telehealth services for the residents of Alaska, Idaho, Illinois, Indiana, Michigan, New York, Tennessee, and West Virginia to help people get the health care they need during these times. AARP state offices are heavily involved in advocating for the safety of people in nursing homes, long-term care facilities, and fighting to ensure that family members receive information and are able to stay in touch with their loved ones in these facilities. All of these are important victories for older Americans. It would not have been possible without the phone calls, the emails, actions from all of you on the phone, AARP members, volunteers, older adults across the country. We really want to thank you. Now let me get back to introducing our distinguished guests. We are joined today by three really distinguished individuals. First, we have Dr. Andy Gettinger. After more than 30 years of clinical practice in both the OR and ICU, Dr. Andy Gettinger transitioned to healthcare policy. Presently, Dr. Gettinger is the Chief Clinical Officer for the Office of the National Coordinator of Health Information Technology, located within the U.S. Department of Health and Human Services. Dr. Gettinger has extensive experience in the field of health information technology and has led the development of electronic health record systems. He's a board-certified anesthesiologist and also critical care medicine. Secondly, we have Dr. Tricia Neuman. As Senior Vice President, Dr. Tricia Neuman oversees the Henry J. Kaiser Family Foundation's policy analysis and research pertaining to Medicare and healthcare coverage and the care for aging Americans and people with disabilities. She's also Executive Director of the Kaiser Family Foundation's program on Medicare policy. Her work focuses on health and economic security of older adults, prescription drug costs, payment and delivery system reform, and policy options to strengthen Medicare for the future. Lastly, we have internationally recognized leader, Dr. Joe Kvedar, in the field of connected health. Dr. Kvedar is Vice President of Connected Health, Partners Healthcare, and a professor at Harvard Medical School. And he also co-chairs the American Medical Association's Digital Medicine Payment Advisory Group. And starting next month, he'll begin his tenure as the president for the American Telemedicine Association, an organization dedicated to accelerating the adoption of telehealth. Again, thank you so much for joining us today. To our distinguished guests, we're going to get started with our discussion. And for the listeners, if you want to ask a question, please remember to press *3 to be connected with one of our staff members. So, Dr. Gettinger, let me begin with you. For the past couple of weeks, the coronavirus has changed the lives that we navigate our daily lives. A visit to the hospital, doctor's office is now intimidating, and we're hearing and seeing more experts talk more about telehealth. Let's begin there. What exactly is telehealth?
Thanks, Jean. And this was a perfect lead-in. The technical difficulties are the kinds of things that doctors, other clinicians, and patients face as they transition from the typical face-to-face office visit or hospital visit to what I'm going to define as telehealth, which is synchronous, meaning it happens with people simultaneously, non-face-to-face, meaning taking advantage of some technology to provide care. And there are a variety of ways that can happen, anywhere from a regular telephone call, similar to what we're doing today, all the way up to full high-definition, high-resolution video conferencing, which had historically been how a lot of telemedicine was accomplished. You know, telemedicine isn't anything new. We've had this huge transition in the past month, but it has been around for quite a while, and I'm going to leave out a couple of things. I'm not going to talk about teleradiology, where radiologists are looking at interpreting images remotely from hospitals from around the world, actually. I'm not going to talk about tele-ICU. It's almost 20 years old, where critical care specialists have been able to extend their reach out into community hospitals that don't have board-certified critical care doctors. That's been a very successful form of telehealth. What I'm really going to talk about is the kind of telehealth that I think many of the listeners are interested in. We had a public hearing yesterday and heard from a number of the large systems how extensively things have changed. The CIO from the University of Michigan described just the incredible engagement by his clinicians. One of the things he did point out, though, is each clinical discipline has different capability to participate in telehealth. So a family practice doctor, an internist, their practice is much more amenable than some of the other practices. So ophthalmology is a good example of a practice that really depends on technology and measurement in the office, so it's much harder for the ophthalmologist. So telemedicine is not a single kind of thing. And the U.S. government, we're going to talk a little bit more about that in a moment, But I do want to share with the audience the U.S. government, the Department of Health and Human Services, is releasing in the next day or two a telemedicine.hhs.gov website with a lot of really good information, both for patients and also for clinicians who have not been doing this before, but find themselves transitioning into this new space.
That's terrific. Thank you for that. And thank you for being so gracious in saying that the technology failures were planned. They weren't, but sure enough, in the days that we're living in today, the flexibility is definitely necessary. So really appreciate that. And I think you alluded to this before. So let's talk a little bit about the changes. So Centers for Medicare and Medicaid Services, CMS, otherwise known as CMS, and private insurers have really relaxed the regulations and expanded coverage as a result of social distancing, staying at home. Talk a little bit about some of the most significant changes. And you've alluded to this already in terms of the different types of care. Are these changes only available to the care tied to the coronavirus at this point, or is it broader than that?
No, it's completely broader than that. All clinical care can be billed for telemedicine at this time, and some of the requirements historically have, as you've mentioned, been relaxed, including relaxation of the ability to use the telephone as a means of conducting telemedicine. That's particularly important in rural areas where broadband is not readily available, either for clinicians or for their patients. So that's an important element. The other element that's important is the Office of Civil Rights has allowed relaxation of some of the HIPAA rules. Those are the privacy and security rules, so that clinicians can use a variety of means, things like FaceTime, Zoom, sort of regular ways of interacting with patients that they wouldn't normally use because of concerns about security and privacy. I will point out that there are some challenges for clinicians to be able to do that. They need to understand how to document those encounters in the record, how to tie it in with their administrative systems like scheduling. And typically clinicians depend on a team in the office. And when you're doing it from home, you are the entire team. So making sure that all of the content gets recorded and covered appropriately requires some adjustments on all parts.
That's great. Thank you for that. So important to note that it's not that you need computers or whatnot. The rules have relaxed it so that telephone connections are available, but important for the physicians to note all the changes and challenges as well. Okay. I think I want to double check. We are having, unfortunately, some technical difficulties, and Dr. Neuman, are you on the line yet or not? All right. I don't think I hear Dr. Neuman on yet. We're going to try to get her back on so that we can have a chat with her about some of these changes. Okay. We are going to shift quickly to take a quick chat with Dr. Kvedar. Dr. Kvedar, we talked a little bit about the different types of care. Dr. Gettinger just mentioned that, for example, internists may be a good route to take in terms of telemedicine, whereas ophthalmology may not. Can you tell us a little bit more about the appropriate terms of clinical care for telehealth? And when you think about it from the patient's perspective, are there things that we need to do differently in preparing for these appointments?
Thanks for asking. Very exciting to participate today, and I completely agree with everything that Andy said. I guess I would punctuate a couple of things. One, probably the most or the best, I think, utilization is these days, anyways, in mental health. It's been even before the pandemic, mental health was taking off as a primary user, and that's a wonderful thing because the need for mental health is so acute right now. So many mental health providers are very comfortable interacting with their patients over a video link and have been doing so. Again, on the other end of the spectrum, as was pointed out, anything that's procedural really can't be done this way. But then there's this middle ground of things like chronic illness management. If you have high blood pressure or type 2 diabetes or congestive heart failure, illnesses like that really are about checking in with the patient and making sure that they're following certain parameters of their health and that those parameters are stable, things like your daily weight if you're a heart failure patient or your blood pressure. Again, if you're tight, maybe you're starting a new blood pressure medicine. With proper in-home tools like a blood pressure cuff or a weight scale, those conditions can be managed very well in this way. And again, thank goodness for that because many of those people are at higher risk for contracting the virus. Virus screening is in many cases, we can do that via phone. It's a lot about asking questions. In fact, and I think many are doing that. In our own delivery system, we now have a software program where people can text or dial in and go through an algorithm with a computer to see if they need to be triaged to get a COVID test or not. And, of course, we have human backup. Doctors and nurses are backing that up, but the first step is simply interacting with a piece of software. So the screening for the virus in many cases can be done this way. And then if people have contracted the virus, but if they're, say, convalescing at home and they have mild symptoms, a lot of that follow-up can easily be done this way as well because it's about calling an individual and, doing a series of questions. The way I've framed it for my clinician colleagues who've been asking is think about the times when you've interacted with a patient when, in order to get the information you need to make a clear decision, you didn't have to touch the patient. And I think that opens up people's thought processes. In terms of, and I'll finish off here because it was the last thing you asked, in terms of preparing for such a visit, I think a couple of things. Don't be afraid of the technology. These days, if you're comfortable with FaceTime because you FaceTime with your family members, ask your doctor's office if they're willing to do FaceTime. Be proactive. Again, we can always revert to telephone for 90% of what we need to do. And the real prep is gathering information about your health. Whether you realize it or not, when you visit a doctor in the office, that your clinician is doing all kinds of observations about your health when they're talking to you, when they're looking at you, et cetera. And that will be easier for them to, again, collect that information and make a good decision about your care if you are prepared. So if you're following blood pressure, make sure you have your readings. If you're following your blood sugar, make sure you have your readings. Any symptoms that you're following, keep a diary. If you're doing something about food, keep a diary. It may sound like common sense, but when you go into the office, a lot of people expect the clinician to draw that information out of them, and it's just going to be easier in this kind of an environment if you are prepared with that ahead of time.
Great, that's terrific. And I think to the point that you raised, Dr. Kvedar, and also Dr. Gettinger, there are pieces of information out there. I want to kind of reinforce that on hhs.gov, there's new information available to both providers as well as patients on telemedicine. And also I want to direct your attention to resources that AARP has available to consumers at aarp.org/coronavirus. We have highlighted a special section around telehealth, telemedicine in the middle of the aarp.org/coronavirus today. So I invite you to take a look at that information so that you can be prepared, know sort of the beginning steps of just how to access this type of service. All right, I think it's time to check again to see if Dr. Neuman is back online. Dr. Neuman, are you back on?
No, she's not.
Okay, all right, we will continue to try to get Dr. Neuman back on. But we have lots of live calls. So now it's time to really address the calls that have already come in. I want to turn to those questions and see if we can have Dr. Gettinger and Dr. Kvedar address those. So please press *3 at any time on your telephone keypad to be connected with an AARP staff to share your question. And it's my pleasure to be joined today with my colleague, Jessie Salinas, AARP Vice President of Programs. Jessie's going to be organizing all of our live calls today. So welcome, Jessie.
Thanks, Jean. I'm happy to be here for this important conversation.
Wonderful. So who do we have online today?
Jean, our first question today is from Patricia in Georgia.
Wonderful. Welcome, Patricia. What question do you have for us today?
I'm concerned with all of the discussion about disparities and minorities. How will this teleconferencing really get to those communities? And are there any protocols that have been set up that specifically explain when we can use this new technology? When is it appropriate? Is it a supplement, or is it replacing what one is expecting from the healthcare system?
Thank you, Patricia. Great question. Let me turn to Dr. Kvedar first, and I'll also have Dr. Gettinger comment on that as well. Dr. Kvedar, what do you think about that question?
Well, I'm so glad you called in and asked, because we're very concerned about that. I think I would just underscore as a first response, and I appreciate this. No one response solves everything you asked, right? It's a very complicated matter. I would say the good news is it's on everyone's mind, and we want very much to have an equitable response that includes as many participants in our healthcare system as we can. So the first response is that we now have, as was said, access to the opportunity to take care of you by telephone, and that should help with any digital divide for the most part. Again, there's going to be some people that always fall off, unfortunately. So that's, I think, the main answer I would have to that. And just to also say that if it's any solace to you, there's a lot of people that are very concerned about making sure that our response to this is equitable and that we don't create a digital divide where one doesn't exist. I don't know, Andrew, if you have other thoughts.
Dr. Gettinger, do you have any additional comments to add here?
Yeah, I think it is something that the federal government is very focused on. A lot of our support in that space goes through state Medicaid programs. There's also one other thing that was done as part of the congressional appropriations. They appropriated $200 million for the Federal Communication Commission to spend to foster telemedicine, including some of the devices that Dr. Kvedar mentioned before, and some of those are targeted for communities that don't necessarily have access on their own.
That's great. Thank you. Thank you for letting us know about the expansion. Let me just check in again. Dr. Neuman, have you been able to rejoin us? Not yet. Okay. All right. We'll continue to check. All right, Jessie, who else is online?
Yeah, our next question is from Sandy in Maryland.
Thank you, Sandy. You can go ahead with your question.
Hi, I have a question. I'm really concerned about this. Next month, I had to cancel my appointment with having my eyes dilated, and as you know, there are some things you cannot do teleconference, but how do you weigh what's more important, going to the doctor for a test like that, or staying home and being safer from the virus? Because you take a risk going to the doctor of the virus, but which is more important, that you not go or that you stay home? I mean, not go to the doctor or go to the doctor.
That's right. Thank you so much, Sandy. I think that's a question that's weighing on all of our minds today. Dr. Kvedar, I'm going to start with you on that question again. how should we consider that? Dr. Kvedar?
Hello?
Yes, hi.
Can you hear me?
Yes, I can.
Can you hear me all right? Yeah, okay, good. That's something I deal with every day myself. I am having these various...
I think we're losing you again, Dr. Kvedar. Can you hear us? All right, Okay, Dr. Gettinger, can you hear me?
I can.
Can you help us with Sandy's question? Again, how do you weigh the options of actually going to see a doctor? Again, I think telemedicine is probably a perfect reason why we can use this at this point. Let me get you to opine on that question.
Yeah, I think it is a difficult question. What are the actual risks of going into the office versus the risks of not getting timely care? What I would suggest is that the best way to figure out what the best course is for an individual is to be in touch with your physician or other care provider. Express the concern you have and see how that trained professional helps you evaluate the right course of action for you.
Great, thank you for that. All right, I'm going to do another quick check. Yes, is Dr. Kvedar back on?
I think so. Am I? Can you hear me all right?
I can hear you. Perfect. Thank you.
Wow.
All right. I'm also going to do another sound check for Dr. Neuman. Dr. Neuman, are you with us?
I am here. Can you hear me?
Oh, wonderful. We can hear you. Thank you. All right. We are really putting our technology lines on test today as we talk about telehealth. I actually want to turn to Dr. Neuman for a second right now. We talked a lot about the changes and the relaxation of the rules, particularly with Medicare. I'd like to turn to you to talk a little bit about that. What are some of these adjustments, particularly from a time standpoint? We understand that there's an end date to some of these adjustments. Can you tell us a little bit more about that?
Well, I think we don't really know because this is really a transition during an emergency period. And so for the period of this emergency, Medicare has waived a number of rules to make it easier for people to be in communication with their healthcare providers via telehealth and various devices. My understanding is that once we are over the emergency period, then Medicare rules will revert back to the way they were prior to the coronavirus crisis. Now, that said, I do suspect there could be a fair amount of pressure to change the rules if it turns out that patients and their doctors recognize that there may be some benefits to having broader use of telehealth, particularly in certain circumstances for people who have difficulties getting to the doctor or when maybe the trip is more onerous than necessary. But that all emerges after the emergency period is over. At that point, it goes back to sort of business as usual for Medicare, which had a much more restrictive set of rules for how telehealth can be used.
That's really helpful. Thank you for that. And I know you've been studying this all along, too. So you've been looking at sort of the possibilities as well as the limits of telehealth for the older adults. What have you seen? Can you give us some insights on that front?
Yes, I mean, we've seen both a broadening of availability of devices and access to telehealth, at least through Medicare Advantage plans. And what we've also seen is that more and more older people are able to connect through the internet with devices in their own homes. And that's a change that's been gradually changing over the years, which at least puts many older people in a position to try telehealth services now that they are allowed. We did a recent survey and found that nearly 7 in 10 adults 65 and older said they had a computer or smartphone or tablet at home. And so that's really good news in terms of being able to reach out and communicate with their healthcare providers. Yes, there are real differences by income. There are differences by race and ethnicity. And I did hear the conversation before, and there is a real digital divide. but the overall numbers are ticking upward, and that's, I think, promising for changing the way in which doctors and patients and others communicate. But what we don't know is whether older adults will feel comfortable using these devices and talking to healthcare providers. That will be a real change. We are seeing actually very few people with experience with telehealth across the board. Just about a little bit more than 10% of people of any age say they've talked to a medical provider in the past few weeks via video or some other kind of device. So I think people of all ages are trying to get used to the new world in which we are living and becoming comfortable, as are their doctors. But it's not clear yet whether older adults will want to use these devices to talk with their doctors. We know that today they are much less likely to do video chatting with their friends and families than younger folks. So it's a bit too soon to tell. There's at least an infrastructure in place so that people may learn to use these devices, may develop a higher comfort level, but for now, not many people are doing that. And so we'll just see over time. And as doctors and patients become more comfortable and more familiar with this form of communication, it may become more common, and we may learn how best people communicate via video chatting and telephones, and if that works or not. So in some ways, this is both an opportunity and an experiment.
Right. Makes sense. Wonderful. Well, let's get to more of our live calls. Again, let me remind folks, if you want to ask a question, please press *3 at any time on your telephone keypad to be connected with an AARP staff member to share your question. All right, we're going to turn to the phone lines. I'll invite Jesse back into the conversation. Jesse, who do we have on the line?
Yep, our next call is going to be from Facebook. This is from Judy, and she's asking, if she goes to the doctor once a year for a wellness check, is it really safe to do a telehealth visit remotely?
Great. All right, that question. Let me again begin with Dr. Kvedar. What do you think about that question from Facebook?
Well, I think that's stretching it, and so much happens in that once a year checkup. There's usually for if you have a high quality doctor, you're having a conversation about everything from your family members to your chronic illnesses to your health prevention, the things that are needed next, whether it's your colonoscopy or your pap smear or what have you. And then there's that physical exam in the office, and probably some lab tests get drawn. Again, I think it's a bit of a stretch to try to do all that via telehealth. It's probably possible in extreme circumstances to do most of it without some of the physical exam part, but it really isn't ideal. I think more likely that, and I think before I got cut off before, I was saying that if you have something routine like that, it's probably okay to put it off for a month or two rather than expose yourself to a healthcare environment right now. The telehealth should really be mostly for follow-ups, mostly for tracking things that you already have a care plan for, those kinds of things, as opposed to a yearly checkup, I think.
Great. That's really clear guidance. Thank you for that, Dr. Kvedar. Again, as Dr. Neuman said before, there is an interesting environment for us to really get better accustomed to telehealth. So let's take some more questions to try to help people get greater guidance on this. Jesse, who else is online for us?
Great. Your next question is from Cheryl in Ohio.
Great. Welcome,
Hi,
Cheryl. What's your question?
This is Cheryl. I'm wondering, because I just used this virtual, which was wonderful for a dermatology problem, which I've had removed because it was squamous cell. Is this going to be covered by Medicare, by our insurances, since it is something that's up and coming, and rather than have to drive, which I would have had to distance, where are we going with this as far as the coverage?
Thanks for that question, Cheryl. Dr. Neuman, let me turn to you first. What are your thoughts on that?
Well, I hate to say it, but it depends. At the moment, this is a covered service, and but it's not clear what will happen in the future, and it depends on where you get your coverage. So if you're covered by a Medicare Advantage plan, which is a Medicare HMO or PPO, they have flexibility. These plans have flexibility to cover telehealth services. And then it would be covered if you happen to be in one of those plans. If you're in traditional Medicare, and at the moment, the majority of people covered by Medicare are in the traditional Medicare program, then it may not be covered, particularly if you don't live in a rural area, which is the part of where Medicare does allow for coverage. And that's why I've been saying I think that after this period of time, there may be more pressure to make changes to Medicare if patients and physicians are comfortable with telehealth, at least in certain circumstances. There may be more pressure to make this a covered benefit, much as it is for Medicare Advantage plans.
That makes a lot of sense. Is there any guidance, Dr. Neuman, for Cheryl is there a number that she can call to check in to see if that's covered or not?
Well, I think, again, it would depend on the plan that you're in. If you're in traditional Medicare, you can always call 1-800-MEDICARE to confirm, or you can ask your doctor, because I'm sure your doctor has access to that information. And if you happen to be among the people enrolled in a Medicare Advantage plan, then you would want to call that plan to find out what they do and do not cover.
Great, thank you for that. All right, let's turn to another call. Jesse, who else is online?
Yep, our next question is going to be from Gilda in Oregon.
Gilda, welcome. What's your question?
Hello. I have an iPad Air 2. My question is, what devices are better appropriated for a viral or a screen time with my primary care provider?
Great, thank you for that. So, question around devices. Let me begin with Dr. Gettinger. What's your advice on that? Computer, iPad, or smartphone?
I think it really depends on how you're communicating with your doctor. If you are using your computer or your iPad just for a voice call, it doesn't matter. If you are using it for video resolution and a face-to-face telemedicine call, then it's whatever device has the best resolution. And so some of the newer iPads have incredible resolution. Some of the other devices have incredible resolution. I think I just saw last week a comment that some of the smartphones don't have as good a resolution. So it's really about the resolution of the device more than the actual device. By the way, it's not just looking at you. It's also the ability to see something that most clinicians don't get to see routinely, the environment in which you live, and that can tell a lot about you as well.
That's really great guidance. Thank you so much, Dr. Gettinger. All right, Jesse, who else do we have online?
Yep, our next question is going to be Mary from Massachusetts.
Welcome, Mary. What's your question?
Hi. Yes, I think it's wonderful that we've been using telemedicine for all those uses that the doctor described previously. But what about for older adults who do need to have tests for procedures during this emergency time? Do you have any advice about the state? Is it safe for them to visit their doctor's offices or to go to have blood drawn?
Great question, Mary. Thank you for that. Dr. Kvedar, what do you think about that? I think we heard that before, but I think some more guidance from you would be helpful.
Well, I would say follow your doctor's advice. That we're all, those of us that provide care are all acutely aware of the risks of the reward ratio of deciding to ask someone to come into a facility. But if you need a blood test, if you need an X-ray, if you need to be examined in person, we're going to take every precaution. Every facility that I know of around where I live, there's someone that greets you at the door. They ask you your screening questions. They make you Purell. They make you wash your hands. They give you a mask. I mean, and then when you're in a waiting area, you're always 6 feet from anyone else in the waiting area. So I think we do our best. We wipe rooms down. We clean them with Clorox. We do all kinds of things now to minimize your risk. The most minimal risk is staying at home. But if someone says to you who's taking care of you, we think you should have XYZ test or XYZ exam, I would follow their advice.
Great. Thank you for that guidance. All right, Jesse, who else do we have online today?
Yeah, our next question is from Virginia in Georgia.
Welcome, Virginia. What's your question?
Hi. Yes, my question is kind of a two-part question. How would you address the challenges of reimbursement and coverage for telehealth services from a provider side? And then the second part of the question is how to bridge the telehealth gap between insurance companies and medical centers for quality telehealth services for patients.
Great. Thank you for that question. Dr. Neuman, how would you address that question from Virginia?
Well, I think I want to hear the second question again, but on the first question, providers are being paid by Medicare as they would be paid for a visit during this period of time. So this allows providers to continue to charge for a visit and get paid for a visit, even if it is happening electronically. Your second question, I would love for someone to repeat that.
Sure. I think Virginia was also asking about kind of the two sides of the coin, the patient and provider. Provider also has, in this time, a need to understand the reimbursement process. So any guidance around quickly getting to close that gap as well?
Well, that's a great question. I think we've been talking a lot about the learning curve for patients, but honestly, I think there's also a huge learning curve that has taken place with providers. And some providers are far more comfortable and familiar with the processes of telehealth than others. And that is primarily around patient care, but also around billing. And I think for that, providers really need to work with the payers that reimburse them for their services normally. So whether it's Medicare, then it should be Medicare. If it's private insurers, then private insurers. Because in a system like ours with multiple payers, the rules pertaining to payment and the amount of payment vary from payer to payer, and that would include Medicaid as well.
Wonderful. Thank you for that. All right, let's turn to another call. Jesse, who else do we have online?
Yeah, let's bring on Diane from Florida.
Welcome, Diane. What's
Hi.
your question? Hello.
I'm worried. Hello, can you hear me?
Yes.
Okay. I'm wondering about dental. How do you facilitate, or is it possible to do a dental visit through telehealth? I'm thinking I'm got a little bit of pain, and I'm thinking maybe the start of an abscess. How do I deal with that in this, or dental in general?
Great. Thank you for that question, Diane. Dr. Kvedar, can I turn to you for that question?
You can, although my knowledge is probably not perfect. I know that there are a number of teledentistry organizations, companies, et cetera. I believe most of their efforts are around more chronic follow-up, as we talked about before. Something that's acute like that, where there's tooth pain and a possible abscess, I think has to be seen in person. And I know around, again, where I live, most of the dentist office are taking calls for emergencies and handling them. So that would be my advice on that.
Great. Thank you so much for that. Let me remind all the listeners, too, that these are great questions. And if you actually have one yourself, please press *3. And also, I wanted to also highlight a resource that AARP has available. It's sometimes really nice to have a friendly voice help you through these challenging times. AARP's Community Connection is a toll-free service for all adults 18 and older. We have trained volunteers standing by to provide a friendly call just to help maybe connect with the person to have an informal conversation during these trying times. If you'd like to speak to someone Monday through Friday from 9 to 5 p.m. Eastern, feel free to call this number, 888-281-0145, and leave us your information. A volunteer will be getting back to you. And you can even set up a recurring call, like every Wednesdays at 2 o'clock for a check-in. Again, it's a free service, AARP Community Connections for all adults, regardless of your membership. And we do also have bilingual capabilities, including Spanish. Again, that number for AARP Community Connections is 888-281-0145. And if you stay online to the end of this call, we'll also be providing an option for you to connect directly to AARP Community Connections. All right, let's hear some more from our experts. Dr. Neuman, we talked a little bit about this before. In what ways have the regulations been relaxed and coverage expanded for Medicare? And how do particularly private insurers align with these coverage changes?
Well, Medicare, prior to the coronavirus pandemic, Medicare really had a pretty restrictive definition for what it would cover. And generally, it restricted full telehealth coverage for people living in rural areas, and then only if individuals had a longstanding relationship with their provider and with certain devices. So this is very much a new world for Medicare and for Medicare beneficiaries. Medicare Advantage, the private plans, have had more flexibility. So over this period of time, Medicare Advantage plans, most of them actually do offer some telehealth services, and it will be interesting to see how much they have expanded the services that they cover and whether they continue to do that after the emergency. Medicare has also allowed more providers to do telehealth services, and this may have come up when I wasn't on the call, but I'm thinking of federally qualified health centers, rural health clinics that can provide these services directly. There's more opportunity for home health agencies and hospice providers. The whole idea is to protect patients and protect providers and to allow people to stay at home, to shelter in place, to minimize their risk of getting infected, helping both patients and caregivers who take care of them. And the change in the rules that have been made for the emergency period could have profound implications in the future for how coverage is treated. But in the meantime, it's really helpful for people because now people have the opportunity. They can call their doctor. They can talk about a problem. They can use just a plain old telephone and make life much easier during this period of time when they're just staying home. And I think it's also an opportunity for people to reach out to others who may be less comfortable with technology and to help neighbors and family members become more comfortable so that they too can use the various devices that are available to them and ask for help. If, truth be told, you have the technology, but you don't know how to use it, this is a great time to try to learn so that there are ways to reach out to more people, medical providers and family members and friends. Medicare also, by the way, has made a few other really important changes beyond telehealth, just to mention. For example, Medicare, like private insurers, has waived testing cost sharing for testing, which is a significant financial help to people who need to be tested. It also has required Part D plans to provide a 90-day supply of medications, which allows people to stay at home for a longer period of time rather than go to the pharmacy. And that, too, is enormously helpful for people who, particularly if they're at greater risk of infection. And it has said that if a future vaccine comes to market, it will be covered with no cost sharing. So for people who may be concerned about, what will be the cost of a vaccine if it comes along, that should not be an issue.
Great. Thank you for that. Thank you for highlighting those changes and also reminding us this is a way that if you don't know how to get connected through telehealth, telemedicine services, maybe reach out to others to ask for some help as well. Again, let me remind folks that you can go to aarp.org/coronavirus, and there is a special section around telehealth, really the 1, 2, 3 beginning steps of how to get connected. All right, thank you for that, Dr. Neuman. Dr. Kvedar, obviously with the sort of trying times, I think more and more folks are experiencing new or heightened anxiety or depression and other psychological issues. You mentioned this before, but how can telehealth help folks in these circumstances?
Well, it's a wonderful solution. In some ways, we tend to think that it may be better than a face-to-face interaction simply because as an individual who has anxiety or depression, it's a big challenge to leave your house and travel to a facility to see someone. So we can see you right now in your own home. And I think it was one of my colleagues mentioned earlier that we get to see what's around you in the home, and that's very important for us in terms of understanding your environment and how that impacts your mental health. Before the pandemic, approximately 48% of mental health professionals had used some sort of telehealth in their practice, so most of them are well equipped. Another thing to just mention is that the physical exam in a mental health visit is talking to the patient, so it's ideal from that perspective as well. There is one caveat I have to mention, which is that even before this public health emergency, there was a backlog of need for mental health services, and now it's even more acute. So there's not enough mental health practitioners to go around, unfortunately. So, but the technology allows us to connect with people very well, and is a great solution for that problem.
Great, thank you for that. Thank you for that reminder, and also sharing your thoughts on telehealth and mental health support. Let me remind folks, if you have a question, please press *3 at any time on your telephone pad to be connected with AARP staff to share your question. Before we turn back to your live questions, I do want to provide a quick AARP Fraud Watch Network coronavirus alert. Scammers, unfortunately, are still trying to get your money and personal information by pitching fake cures and even constructing fake testing centers in some communities. They are all offering bogus investments, impersonating medical professionals to collect payments, posing as global health authorities, conducting phishing campaigns designed to trick recipients with malware or ransomware. This week, coronavirus stimulus payments are beginning to hit bank accounts, and the scammers are trying to get a piece of that action, unfortunately. Scammers are calling, emailing, or texting, saying that they need money or bank account information to deposit or speed up your stimulus check payments. It's important to know that the federal government will not be calling to ask for information before processing any of the stimulus payments. For official information on economic impact payments, please visit Corona Tax Relief, that page, at irs.org. irs.gov. Again, visit the Corona Tax Relief page at irs.gov. And if you suspect a scam, please visit aarp.org/Fraud Watch Network. You can search scams in your area or actually report a scam, take action, and fight against scammers. Or you can call our helpline. The Fraud Watch Network helpline is at 877-908-3360. Again, we have volunteers on staff to answer your calls at 877-908-3360 at the Fraud Watch Network helpline. All right, let's take more of your questions, and we'll get Dr. Kvedar, Dr. Neuman, Dr. Gettinger to respond to them. Remember, press *3 at any time on your telephone keypad to be connected with AARP staff to share your question. And again, for more information, as I said before, you can go visit aarp.org/coronavirus. There you can actually see more information about the coronavirus. And if your questions aren't answered, there's lots of resources there. All right, turning to your questions. Jesse, who else do we have online?
Yep, we're going to bring on Ken from Michigan.
Hello, Ken.
Hi, how are you? So
Good.
my question is, are there any potential medical malpractice issues specifically related to providers of telehealth?
Thank you for your question, Ken. Let me begin with Dr. Gettinger. What do you think about that?
I think it's a great question to ask. I think many physicians and other clinicians have asked similar questions. I think if you provide effective care, you do all the things via a telemedicine visit that you do in the office, absent the obvious physical exam. It's unlikely that the fact that it's a telemedicine visit would increase your risk in the liability space. I say that with a caveat that I am not an attorney and not necessarily an expert, but certainly in 30 years of practice, I didn't practice being worried about those things. I just wanted to take good care of my patients. And that's what telemedicine allows us to do during these very difficult times.
Thank you so much for that, Dr. Gettinger. Jesse, who else do we have online today?
Yeah, we're going to bring on Queenie from New York.
Hello.
Hello.
Yes,
hi. Now, I am a high-risk patient, and I'm very concerned about the experience I had at the hospital when I went, because I'm an asthmatic, and my doctor advised me to go to the hospital. And on my first visit there, I was given a chest X-ray, and I was a flu shot and the virus, and they sent me home with some asthma medication and told me to stay in for 14 days. 14 days afterwards, I called my primary doctor, and I was still feeling not well, so he told me he wanted me to return. So I returned back to the same hospital, and then when I got there, they took a CAT scan, did another X-ray, and told me, did another also the virus test, and told me that, well, I had an infection of the chest, and the doctor said that she was, concentrated on having me admitted, and she said, but there were no room at the hospital that I was at. She was going to have me admitted to one of their sister hospitals, and so I asked her, was it a designated virus hospital? She said yes. So I informed her that I had been tested, and I had a negative test. And she said, I asked her, would I be in a private room? She said no, that I would be sharing a room with someone else who has the virus. And I was just very, very concerned, because if I don't have the virus, then why am I, going to be sharing a room with patients that do have the virus?
Thank you, Queenie. Thank you for that. Dr. Kvedar, in the circumstance like this, would telemedicine be helpful in any way, given the circumstances that we just heard from Queenie?
No, sadly, I don't think so. I think the need for the testing that she described, the fact that she has asthma, I think, from what I'm understanding, that the doctors were very, very, very concerned about making sure she was well taken care of. The last part is hard to know without having been there. I don't think anyone would knowingly put you in the same room with someone who had coronavirus. I think that's unlikely. I know hospitals are stretched right now for capacity, but people are getting sick with things other than the virus, and an asthma attack or a chest infection made worse by asthma is a serious thing. So, but again, I don't think telemedicine is going to play a role in sorting that out, unfortunately.
Great. Well, thank you for that guidance, Dr. Kvedar. All right, Jesse, who else do we have online?
Yep, our next question is from Facebook. We have Monica, and she's been asking whether co-pays and deductibles are waived for telehealth, specifically around chronic care management and things like that.
Great, thank you for that. Dr. Neuman, what do you think about that question?
Well, I think it's going to vary across different insurers, so I don't think there is a single answer to that question as far as I know. So yes, it's covered, but it is not, cost sharing is not routinely waived. Cost sharing is waived, as I think I mentioned before, or if it's a physician visit associated with a test, but not consistently so.
Great. So probably some legwork and some extra research is needed to figure that out. Great. Thank you so much for that.
Mm-hmm.
Jesse, who else do we have up next for our calls?
Yep, I think we have a similar question from Tom in Pennsylvania.
Sure. Hello, Tom. Hello, Tom. All right, I think we might have missed Tom. All right, who else do we have online, Jesse?
Let's bring online Jean from Massachusetts.
Hello, everyone. This is Jean from Massachusetts. I run a council on aging, and while we are not physically open, we're making a tremendous number of care calls out to our patrons, and we are dealing with a high degree of social isolation, and we know who these folks are, and we can talk to them at length. However, because we are a community-based services organization and not a clinical organization, we can't really intervene to let their physician know what we're finding out. So my question is, are physicians who have profiles of patients that are seniors, that are prone to mental health issues, are you proactively calling and reaching out through telehealth to these patients? And if so, is this covered? And what are the various physicians doing regarding the fact that, you know, on a typical day, I had 150 to 160 seniors coming through for a range of activity, one being connectivity to other human beings, and now they cannot. And but we are making care calls out to them. So what is the healthcare system doing proactively through things like telehealth to connect with these older adults?
Great. Thank you for that question. Dr. Gettinger, I think I'm going to start with you. Do you have any thoughts on that?
Well, it's again a great question, and I don't have any particular insight into what community clinicians are doing. What I did hear yesterday, which was a bit surprising but really happy news, it was from the Secretary of the VA, who described that in these circumstances, again, an older population with a lot of medical needs, that in this window of time, that population was actually doing much better than expected in a variety of ways, not the least of which they've seen a dramatic reduction in veterans who've hurt themselves. So I think, and that was, he attributed that to the increased communication that was going on via telemedicine type encounters. Again, that's the VA population. I'll let others comment more generally on the community.
Dr. Kvedar or Dr. Neuman, do you have any thoughts on the last question?
I would just say our clinicians are pretty stretched right now, so it may not be happening to the degree that we would like, and I completely would just endorse knowing the impact that social isolation has, and it's a significant one. But that said, I think, as I said earlier, our mental health professionals are sort of dealing with as much incoming and sadly may not have the capacity to do a lot of proactive outbound outreach.
And Dr. Neuman?
The only thing I'd add is I'm hearing, and this is really word of mouth, that this varies by medical profession and practice. Some physicians and mental health providers specifically are reaching out to offer their patients the opportunity to get treated, which is not to say that there aren't capacity issues. Of course there are, but I am hearing of some outreach from providers. And I'm just wondering if the caller might want to think about encouraging the clients that you see who are dealing with depression or other concerns related to social isolation to reach out directly to their physicians or other providers in order to get help, either to maintain some kind of connection with in an ongoing way with a mental health provider, or to find someone else who might be able to provide support during this period.
Great, thank you for that. All right, Jesse, who else do we have on the line?
Yeah, but we've got Tony from Washington on the line.
Yes. I would like to know, in terms of the security and privacy of utilizing Zoom and telehealth. Excuse me. My provider is in Sequim, Washington, about 16 miles from where I live in Port Angeles. I take, excuse me, I swallowed wrong. I take paratransit, ADA transportation to get there, and I only have that transportation. I would like to know about this because I understand the provider and the provider's clinic only uses Zoom for telehealth if I ever needed to see my or talk to my doctor. What do I do? How do I approach this?
Thank you for that question,
I'm not telling.
Dr. Kvedar, Dr. Gettinger, I know you both talked about this. Let me begin with Dr. Kvedar. What are your thoughts around the various forms of video connections, for example, with Zoom and everything that we're hearing about privacy concerns there?
Right. Thank you. It's a wonderful question. I think the news is good. There have been news stories about people breaking into Zoom meetings. And as far as I know, all of the ones that I'm aware of were times when people posted a Zoom link on some kind of a public forum such as Facebook or Twitter. Again, most of the ones I heard about were Alcoholics Anonymous meetings or Narcotics Anonymous meetings. And although I think those were very sad stories because of the meanness and nefarious intent of the person who dialed in, I wouldn't call it hacking because the link was out there in public. I think if your doctor wants to use Zoom, make sure that they share that Zoom link with you in a very private way, maybe over a patient portal, something like that. And I think the likelihood that you'll be have your privacy interfered with is extremely low. The other thing I would say is that the real important part of the privacy conversation is how your visit is documented in the electronic record. And again, that's not changed. We have as private as possible systems for electronic records. So I would just close by saying I think the chance of having your privacy invaded in a telehealth interaction is extremely low, and I wouldn't let that get in your way of having a conversation with your doctor in this way.
Great, thank you for that. Dr. Gettinger, anything to add to
that? No, I completely agree. The only thing I would add is the FBI has put out some guidance for Zoom gatherings generally, and some of that guidance involves always using a password in addition to making sure that the link is private. And then there actually, and I'm not sure which version your physician uses, there's the free version, which has been a little bit more susceptible. The professional version or the version that you pay for has more security options available within it.
Great, thank you for that guidance. All right, in our last couple of minutes, I think we have a few more calls online. Jesse, who else do we have online?
Our next question is going to come from Reed in Wisconsin.
Hi, this is Reed. I have concerns about the digital divide. I know here in Wisconsin, the governor this year had gotten funding for access to broadband for more of the state. And what the intent there is that a lot of the sophisticated telehealth takes place with a bandwidth that would be very useful, to diagnosticians. You pretty much have to have broadband for some of those things, and it seems to me that it tends to be a geographic digital divide, where rural areas, the companies that provide it don't seem to have the economic wherewithal or impetus to provide it. I just wondered what the thoughts are there.
Great. Thank you for that question. Dr. Gettinger, I'm going to start with you.
Yeah, no, I think that's a real issue, and I can assure you that a number of us in the government are talking about it. It is, at least historically, just to go back many years, when the only way we communicated in rural areas was with landlines. Folks who are providing clinical care or available on call would get priority. The FCC, when it was regulating in a different way, ensured that telecommunication providers did that for clinicians. I'm imagining a future state where telecommunications for clinical purposes would be equally supported, and we completely recognize that that's not the case now. And the bad news is, as so much of digital connectivity moves to 5G, and fiber and copper lines are not how things get to people, especially in urban areas. In rural areas, 5G just doesn't have the distance penetration that will be necessary. So I think this is not going to go away as an issue. And what I've seen, I'm in rural New Hampshire currently, and I've seen local communities recognize that their vitality and future depends on doing broadband, so that broadband is becoming a service that's not just telecommunication companies, but is serviced by the local community as well.
Great, thank you for that. Dr. Kvedar, do you have any thoughts to add to that from the Telemedicine Association perspective?
Well, we advocate for more broadband for more people. It's a real issue. I'll go back to saying that it's not, all is not lost. Given during the public health emergency, we can use telephone, and I mentioned that earlier, but that doesn't take away from my enthusiasm for having more broadband for more citizens, especially in rural areas. I completely agree. It needs to be done.
Great, thank you. All right, I think we have time for just one last question. Jesse, who's our last question?
Yeah, the next question comes from Facebook, Gene. It's Jim from Colorado, and Jim is asking whether there's any relief for Medicare premium payments during this pandemic. They say they pay a lot for insurance, and they really could use some help right now.
Great question. Dr. Neuman, can you help us with that question?
Well, that is a great question. I have heard discussion about providing relief on cost sharing, particularly for COVID-related treatment. I have not heard anything about providing relief to people with premiums. I mean, it is a serious concern that many people on Medicare, not exclusively Medicare, but many people on Medicare struggle with health expenses. And I think what this situation is bringing to light is that it's premiums, it's cost sharing, it's the whole package together that consumes a fairly large share of people's retirement income. I'm just sorry to say I haven't heard any discussion about premium relief.
Great. Well, thank you for highlighting that for us. We are running out of time, so let me ask our, again, esteemed panelists to kind of give us some closing thoughts, beginning with Dr. Gettinger, moving to Dr. Kvedar, Dr. Neuman. Any thoughts that you have for our members, our listeners today, What are some last thoughts you'd like to leave us with? Again, Dr. Gettinger, you want to kick us off?
Absolutely. Just as we experienced on the call today, a little bit of bumpiness here, a little bit of bumpiness there. Stepping away, I would say the call was very successful. I would say being tolerant, being patient, telemedicine for many clinicians and for many patients is a new mode of care, and I believe it's one that is here to stay. But it's going to take us a little while to work out all the kinks, figure out what best practices are for an individual clinician as well as for patients. So I continue to be very optimistic and enthusiastic. So thanks for asking.
Thank you. Dr. Kvedar?
Well, echoing my colleagues' enthusiasm and thanking you for inviting me to this. What I've been reminding folks like your listeners, so this is a plea, if you have a good experience, tell your congressman or senator that you don't want to go back to having only one channel for healthcare delivery, which is having to go into the office. As we said, not everything is going to be ideal for telehealth, but I would say the flip side is if we can't emerge from this crisis with more than one channel for healthcare delivery, then it's a sad day for our country that we have to go back to what is really a 20th century style of delivering a service. You have to come see me in a physical location, and that's the only way to get something done. So speak up, talk to your politicians, and make sure you know that they know that you don't want to go back.
Thank you so much. And Dr. Neuman?
Yeah, I agree. It's going to be very hard to put the genie back in the bottle. And I also agree that patients and doctors are at a steep learning curve right now, and this is a time when people are working out the kinks. We'll want to use this time to learn how well telehealth works, when it doesn't work, and how to make it work better. This is an opportunity to use a new technology or an old technology in a new way to help us all stay safer. It's an opportunity for people who are not so familiar with this type of technology or communicating in this way with their doctors to become more comfortable with it if they choose to, and help us all figure out when this is the right line of communication and how to make it work in the best possible way to improve our safety and to improve the communication that we have with each other. So I think this is a great opportunity, and I don't think I think it's highly unlikely that we'll go back to business as usual without so much reliance on telehealth, but how we use it, when we use it, is still an open question.
Great, thank you for that. Again, thank you so much for your patience with us today. I think we were modeling the beginning of the future of telehealth with our technical difficulties. But thank you so much for your optimism. Thank you so much for your practical guidance. I think we hopefully have allayed some questions and concerns from our listeners today, and it's been such an informative discussion. I want to thank each of you for joining our call. And I want to thank all of our listeners, our AARP members, volunteers, for participating in this discussion. Again, let me just tell you that we do have the ability to provide you a friendly voice through our AARP Community Connections. We have trained volunteers standing by, as I said before. This is a free service for all adults, regardless of your membership, and we do offer some bilingual capabilities, including Spanish. To be connected right now to the AARP Community Connections, you can just press *0 on your telephone keypad, and your call will be routed to the service. Again, please feel free to press *0, and you can, again, be connected to this free service right now. Or you can call at any time, 888-281-0145. Again, that number is 888-281-0145. AARP is a nonprofit, nonpartisan membership organization, and we've been working hard to promote the health and well-being of older Americans for, again, more than 60 years. In the face of this crisis, we're providing information and resources to help older adults and those caring for them protect themselves from the virus, prevent its spread to others while taking care of yourself. All the resources referenced, including a recording of today's Q&A event, can be found at aarp.org/coronavirus by April 17th. Again, that website is aarp.org/coronavirus. Please visit this website. If your question was not answered, you'll find the latest updates as well as information created specifically for older adults and family caregivers. We hope you learned something that can help keep you and your loved ones healthy. Be sure to tune in next week for our next AARP Teletown Hall. We are, in fact, offering 2 Q&A events next Thursday, April 23rd. The first, again, will be at the same time, 1 p.m. Eastern Time, where we're going to be focused on caring for your loved ones in facilities such as nursing homes and long-term care facilities. And we'll also be offering a separate topic for a conversation at 7 p.m. Eastern, focused on the unfortunate disparate impact of coronavirus. But I want to thank you again for joining us today. Have a good day, and this concludes our call.